vaccination and screening is maybe that we could spend a little time this morning to think about, we're targeting women in the community and thinking about who would be the people who would influence a woman's choice to either get screened for cervical cancer herself or to have her daughter vaccinated against HPV. These are two of the most clearly important cervical cancer prevention interventions that we could deliver. And so what I'm going to ask is that we spend a little time, maybe I'll give everyone 2 or 3 minutes to use the forms on your table and to start jotting down who are the people, including the women themselves, that you think might influence a woman to choose whether she's going to get her daughter vaccinated or she herself participate in an early detection and management program or a screening program. So I think with my colleagues, they're in Karachi, maybe we can facilitate, let's give ourselves 2 or 3 minutes to jot down, and then I might ask that we have representatives from each table come up to the microphone and we can start noting down who are the people who are going to influence this decision. And then what we're going to do is to think about, for each of those individuals, where would they get their trusted information? That's going to help us to understand what's the avenue that we can work through to make sure that they have the accurate and most up-to-date information. We also can think about what they value so that we can understand how to frame our information in a way that will be the most acceptable to each of those different influencers. We may want to think about as well some of the myths that we may already know exist in the community, what they are and how we might address them. And then I think at the end, we can think about potential interventions that we might think for each stakeholder in terms of how we prepare them to introduce these really important cervical cancer prevention programs. So if I may, I'm going to just set a timer and let's give ourselves 3 minutes to go through and jot down who are the people that you think are likely to influence a woman's choice in terms of their participation in screening and vaccination programs for their daughters. So I'm going to start the timer now, and when it goes off, hopefully that we can have people one by one come up, and we'll start a list and we'll put this on the screen that's projected. So I'm starting timer now.
Thank you, Professor Petty. Everyone is now starting.
Okay, I have 1 more minute.
Time's up.
Just about 30 seconds.
Okay.
Okay. Great. So can we have some people come up to the microphone
Yeah,
and
sure.
start?
I invite Dr. Denise Fatma. She's gynecologist.
Mhm.
Bismillahirrahmanirrahim. Assalamu alaikum. Good morning, everyone. Okay, I'm coming from the gynae and obstetric department from Patel Hospital. It is a private sector hospital, and I'm a gynecologist, Denise Fatma. My name is Denise Fatma. So, regarding the barriers to prevent regarding vaccination as well as cervical screening, what factor I think that is most important for us? Like the first question is, who may influence the choice to be a screen or have daughter of vaccinated? So I'm a gynecologist. I have a daughter of 13 years old. For many days, I'm thinking about to vaccinate her, but I am not so much, you can say I'm not so much counseled and so much thinking about to do it in a importance level. So after this symposium, I think being a gynecologist, being a mother of a 13 years old daughter, it's my first thought to go and do her vaccinated, number one. So what factors I think might influence us ourselves first. The second thing is the most important, the doctors. We have almost 200 or 250 patients OPD per day in a private sector hospital, and almost we have 50 to 70% of women from the gynecological problems, and they most of the time they come with their young daughter, and we can counsel them regarding the importance of vaccination, especially if they are coming to our OPD. This is the best place for her. Second thing that we can do is involvement of multimedia. You can say that today, after COVID, we have a lot of information through the media. We have a lot of information from the television. So if there is some involvement of stakeholders that can transfer this message that why the vaccination is so important for these young girls and why this is can reduce the risk of cervical cancer in later on. So this is one aspect that we can work about it. The other things is definitely our politician, our government should think about it as a health priority for implement the vaccination program in EPI, national program. So women can avail this vaccine in the low price, or we can say the free. Today we can buy this vaccine and we can provide. So everyone cannot reach to the to get the vaccinated their daughter. So this is the one factor. Okay, where they get the trusted information? Definitely, we are educated people. We know about the importance of vaccine. So definitely we have a role to counsel them, to educate them. Even though we can counsel our staff, our nurses, our midwives, and again, in a community level, the lady health worker, those who are visiting the families, those who are visiting the newborns for the vaccination, they can counsel them. And school is a very important area. That's why kids get the forms to vaccinated regarding the COVID vaccine. Similarly, they have a form to counsel them regarding the vaccination for the cervical cancer vaccination. Why do we value? We all know we are here just to emphasize the importance of reducing the risk of cervical cancer. So this is a very important women health issue, and we think about it, and we should all value it. First, we should value it, then definitely our other females or women should think about it. Okay, myths is very important. First day, when I was in the lunch time there in the hall, the one girl that is a student of this institute, she said me that, doctor, I thought that this vaccine can cause infertility. So this is the basic myths of our people, that this can cause other cancers, this can cause infertility and other health issue, and many other barriers that we don't know so far, but the people have a lot of myths about the vaccine, especially if we are choosing a very young girl, 13 years, and they thought there is all system will be disturbed if we give us some vaccine. And what can we do to for HPV vaccination? Okay. First of all, we should be proactive. We should do hard work on ourselves. We should counsel. We should give the time to the patient, because we are always in hurry. We are obstetrician as well. So we are busy. We not have a lot of time. That you know that we have a very huge number of gynecological surgery in our hospital. And but if we see the data that how much pap smear is available in our hospital, but we have very minute number of women that have this screening. So what is the problem? Basically, we don't think that pap smear is so much important to take a part, to keep it the basic investigation, like we do the ultrasound, we do the CBC. Similarly, we can use the pap smear as a first line investigation if we have admitting this patient for any surgery. So this would be provide a best chance to get a screening. And as we all know that NHS says that if woman has 2 screening at least one in her life and both are negative, that can reduce her risk of cancer so much. So we can at least do our chance by, as a woman came in our OPD, we do the pap screening, pap smear test that we are doing, but in a very minimal number. So we can do all these things to reduce or eliminate the cervical cancer. Thank you so much.
Thank you. I've tried to capture as much as I could on the screen, and so maybe can we? Is there someone else that we can add to this?
Thank you very much, Dr. Kanis. Now I am calling Dr. Bushra. Hira Bushra.
Good morning. My name is Dr. Hira Bashir. I'm from Sindh Government Hospital. I belong to OBGYN family. This regarding cervical cancer vaccine, who may influence a choice to be screened or have daughter vaccinated? As Dr. Kanis said, I will further add that yes, it's very important that all the doctors, they should be first aware of this thing. And then we should train our lady health workers, midwives, and our medical community should be well aware of this vaccine, that it's easily available and it has got no harmful effects and it's beneficial for the young girls. So first we need to educate our medical faculty for this. Secondly, then after educating them, I think friends, family, friends and relatives, they do play a role as well, that if somebody's daughter has got vaccinated, she'll encourage other female as well to get her daughter vaccinated. In this way, a chain we can develop and we can convince them more. Thirdly, there should be much more counseling, and there should be sessions on the community basis, like after COVID, and we have got a very good social media. So we can add a lot of things on that. We can use Facebook, WhatsApp, Skype, and much more things to create awareness regarding the vaccine and make its availability first here in our country, so that people should get benefit from it. Now, where do they get trusted information? They get trusted information first from the medical professionals because they have got the most of the knowledge from them. And in our setup, mostly we have got community-based work done by LHWs, and we have got midwives, and they go for vaccination. So they can get information from the medical people and from hospitals, and then from the other, like Dr. Denise said, that yes, regarding COVID vaccine, we have got a very good response from the schools as well. We can have sessions in different areas, like in schools, in the hospitals, in universities, and we can have sessions even at the shopping malls. We have got Panaflex, and we have got advertising. We can advertise in the shopping malls as well, at the hotels, restaurants as well. So there's no harm in increasing the chances of educating people. And what do they value? People like in Pakistan, they do value money as well. That if the vaccine is expensive, it may be difficult for them to buy and to approach. So if it's easily available and it's cheap, so they will definitely get it vaccinated for free to their daughters. And prevention for the cervical cancer is another thing that should be kept in mind, because that is our main aim. So as I already told, that if we give them more information regarding the harmful effects of this cancer and what it will lead to, we need to educate them regarding this disease. So it will help them to encourage their daughters to get vaccinated. Because the mothers couldn't get vaccine because it was not introduced, but now since it's available, it's easily available at their doorsteps. Like there is a plan of introducing it in the EPI system. So when it will be easily available and it will be approachable, then the people will be agreeing it to yes, it can be given to their daughters. Regarding the myth of the vaccine, unfortunately, in Pakistan, what we have seen previously, that whatever vaccine you introduce, every other person says that it will cause male or female subfertility, whether it's COVID vaccine or any other polio vaccine whatsoever. So we need to clarify this to our generation and to the people that not these vaccines are for our prevention of disease, and it's not something that causes subfertility, or it does not cause any other reactions or any reproductive issues, which is the main concern for vaccines in our setup. People don't care about the things that it might cause any fever, temperature, or any other thing, but they are more concerned regarding the reproductive issues. So we need to clear them on these issues. Possible interventions that we can do is that I already told, that we need to, we have done for COVID, for this, we like this, and polio, we are doing it for polio as well. We need to create public awareness regarding the cervical cancer, regarding its screening, regarding its prevention, what should be done at what step. First of all, the females are to be educated that yes, they should get vaccinated. Sorry, they should get screened for cervical cancer as well. And when the mothers are counseled for screening, then we can go for prevention of their daughters by introducing vaccine to them. So we can use social media, we can use educate our lady health workers and LHWs and midwives, and we can, in this way, we can have public awareness sessions, programs on radio, television, on our internet. So in this way, we can, I think, help in making it an easy pathway for us. And as far as religious things are concerned, yes, we need to involve our religious scholars as well, who should be with us in favor that yes, this will not cause any harm or it's legal, and there are no ethical issues. Thank you.
Thank you very much. Now we have Madam Farhana.
I'm really very grateful to Dr. Hana, who has provided us the chance. I'm Pakistan's first advanced nurse practitioner, and I'm doing PhD in nursing education. And I'm very grateful to you for inviting us. Since yesterday, we have been listening to the advocacy, capacity building, and policy makers, stakeholders, but nobody has talked about the nurses' role. Nurses play a very important role in primary healthcare, primary prevention, and we are far behind in achieving the sustainable goal 17 UN sustainable development goal. We are very, very low in this situation. Out of 198 countries, we are at 134th position. And we have a great number of maternal and child health problems. And we have a great number of mothers dying because of the cancer, for cervical cancer. Every year, 5,000 women die because of the cervical cancer. But we don't have an advanced nurse practitioner role developed in cancer prevention and cervical prevention. And when we talk about BHU, the basic health units in Pakistan, there is no empowered nurses there, LHV, community health nurses. So we will be working on empowerment of the nurses role in this, because the mothers are very afraid of even thinking of vaccination of their young girls for the prevention of cervical cancer. If we talk about that to the middle class or lower middle class, so low socioeconomic class women, they will not even think of discussing this matter with anyone or involving their young girls. So who are the most important people? Mothers and nurses. And what information, from where they get the information? Definitely the BHUs, the primary healthcare prevention centers, which need a lot of development in Pakistan. हमारे यहाँ तो I will say that in Urdu, हमारे यहाँ तो घोड़े गधे बकरियां बंधी हुई हैं हमारे BHUs के अंदर. Instead of they do a lot of public health training. And what they value, the mothers and the nurses. Mothers want someone to talk to them. They value nurses' role. But the problem is that we don't have LHVs and community health workers, community midwives being trained in this particular field. I'm working on development of nurses' role in Pakistan for diabetes management. And we have been able to do that diploma started in Pakistan Nursing Council. But when I was invited for this, and I looked at it, we are developing a course for 4 weeks course for the LHV and community health nurses for diabetes. So I thought, because for me, it was the first time I came about to know about this conference. And I thought about it, okay, when we are developing role for community health nursing, why not we include this vaccination awareness program, this vaccination information in that one? So what would be the value? It will increase the maternal health and young girls dying of cervical cancer. I've seen very young women, even at the age of 30, they have developed the cervical cancer. So what are some myths? The myths are that vaccination is not for young girls. Vaccination will not prevent cancer. Vaccination is going to harm the young girl's sexual life in the future. And it will disturb their fertility. And it will cause some other kind of cancer. They say if you give the vaccination to young girls, it will make them infertile, or it will be actually causing the cancers in the future. So possible intervention, definitely policymakers, stakeholders, everyone involved in the public health, primary care prevention, we have to look at it, that we have to start the screening program. The medical camps we do, we have to give them the awareness, and we need to develop the nurses' role. We have to empower the nurses in this field. Then we can only achieve to reduce the cervical cancers in Pakistan. Thank you so much.
Thank you. That's
Thank you.
fantastic.
And we have actually some students and who also want to discuss their fears. So can I call one student?
Yes.
Rita, can you please come?
Hello, my name is Sayyida Maria Jilani and I'm doing my MPH research in National Institute of Virology. So these 3-day conference is a very important to me because my MPH thesis research is to find the prevalence of high-risk HPV genotypes in a Pakistani female population. And I'm currently focusing on the population in Karachi where I reside. So, we started our research since March 2020, but the availability of pap smears and the availability of samples has not been possible because, usually when I go to hospitals, there are doctors who doesn't even know what pap smear is, and then yes, there are that kind of doctors. And otherwise, wherever I go, they say, sorry, we don't have any information about pap smear, and sorry, we don't do that over here. So I am currently facing really problems in collecting the good data and good samples. I have a collaboration with Multimedia Hospital, Dr. Denise Fatma. She has been helping me a lot. But other than that, I don't have any other gynecologists that could provide me with good data and good samples. So I want to ask this here so I could get this opportunity to get to know you guys. You can help me out and I can help you out as if that's possible. Thank you. And you can I'm here available all the time. So if you want to, I can discuss my work with you. I can discuss whether if you can take that forward. Thank you.
Okay, thank you. I think maybe it's a good time now for us to kind of start looking at some of these responses and thinking a little bit more deeply about what would have to be. And I think one of the things that I find to be really important, I can tell you that I've worked in multiple different countries, working with health systems to try to set up mostly screening programs, but I think that everything that we're doing would be perfectly applicable to vaccination programs. One of the things that I always tell myself is that no matter how well educated I am, I have to really go into a community being very humble to say, I really don't know and don't understand the perspective of the people that I'm offering these services to, that we're trying to help to prevent a really curable disease. And so I think one of the things that maybe we can talk a little bit about is maybe taking kind of, a few of these people and let's put ourselves in their shoes for a minute and think about a little more carefully about what are going to be the ways that, for example, we might address the concerns about vaccines causing infertility. And let's think about that in multiple different stakeholders. So I might first pose the question and have some people come up and respond. What do you think the medical professionals feel about vaccines and the potential that they cause infertility? Do you believe that in Pakistan, at any level of the healthcare professionals, the doctors, the nurses, the midwives, do you believe that any of those people delivering services are in any way perpetuating this myth? So we're trying to think about, where these myths come from and who do we need to speak to, educate and convince to make sure that these myths don't continue to perpetuate. I can tell you that in the United States, with regard to COVID, we got a lot of mixed responses about vaccine efficacy, not just among community members, but also among healthcare professionals. And I think that as you're preparing the foundation for these programs, and I would again refer you back to the Malaysian experience, where they did a really nice job of being very honest with themselves about what people were truly thinking and believing, and trying to address any misconceptions before they introduced the vaccine, to make sure that everyone was on board, and they managed to get more than 80% coverage of vaccine almost immediately, and have sustained that for 10 years. And I think these are really good models to go from. So does anybody want to come to the microphone and maybe talk about kind of whether the medical professionals themselves might have some misconceptions about papillomavirus, about the efficacy of vaccination, about the potential side effects with regard to infertility? And then we can discuss how we might address those. I'm hoping somebody will step up. If you don't want to speak about the health professionals, maybe speak about the women and what it is, what's the experience of how we can convince the women that these vaccines are not going to cause infertility. In fact, the evidence suggests that having HPV itself is more dangerous to your fertility than getting vaccinated against HPV. Does anybody want to have a go at thinking about kind of where these myths come from, and what would be the appropriate message to try to dispel these myths, appreciating and respecting the perspective of the people who hold them? Anyone? No? Because I think one thing that we were hoping to do with this exercise is to remind ourselves that there are a lot of different stakeholders. One thing that we haven't put up, for example, is how the women and their partners, their husbands, may be influencing the decision to be vaccinated or to be screened. Do we believe that there's a need or an importance to educate the husbands as well, as we prepare to deliver HPV vaccination to the girls in the community? Sorry, it's very difficult to be interactive when I'm on Zoom. I'm hoping someone will come to the microphone and maybe engage a little bit in this conversation, because these things are really important. We can say that we need to educate. Yes, we do. But we also need to really examine carefully what's the underlying motivation of people's beliefs, be respectful that they have them, and think about what's the best venue to try to dispel myths and prepare a population to actually be able to accept our intervention programs. So maybe somebody can speak to your experience with COVID vaccination, and maybe how you have worked to try to dispel myths and get more COVID vaccination. And we can think about how we could apply that to papillomavirus. Sorry, can everyone still hear me? I think the microphone on your end is muted, so I don't know if someone else is speaking.
Can you hear us?
Yes, now I can.
Okay, now can you hear me?
Yes.
Now, what I want to say is, as far as the myths are concerned, yes, there are too many myths. Even the educated class, the doctors themselves are not very sure. They do think that vaccines, especially about the COVID vaccine, many people do still think and used to think that would it cause, would it disturb our potential to be fertile, especially the newly married couple or etc. So we used to tell them that if you live up to that stage, getting a vaccination can save your life. If you lose your life during Corona, obviously the fertility potential will not. Regarding the second question, human papilloma virus vaccination, there should be a mass awareness. And I think personally, as a gynecologist, it is our responsibility to spread, fix days, fix time in our busy clinics, so that we should sit with mothers of young girls and we should talk, discuss with the husbands, with the spouses, that this vaccination is a, I personally believe in my culture, especially in Pakistan, what is the myth, the most effective myth is that it would either disturb our health status or it would cause infertility. So the starting point should be a mass awareness. Busy clinics should be, there should be special time and days allocated for counseling. I think maybe in year time, in 2 years time, although I know that it is like a bit difficult to counsel, but eventually in some time else in future, we will achieve the goal. That's what
That's fantastic. And I wonder if there's any possibility that the gynecologist can also work with community members to teach them how to bring awareness, and what kind of venues besides being in the hospital, because as you say, you know, when you're in a busy clinic, it's very difficult to take the time to do the counseling. So can you think about other people that you could train and where you might go out and have those people send the message that you're teaching into a broader community, so that it doesn't take away from your time in the clinic, which is going to be limited. So any ideas about where that could happen in Pakistan?
At schools, they can, like, we plan a parents teachers day. That parents teachers day can be turned into a human papilloma virus vaccine awareness day. We can call parents, for example, the higher classes, 9, 10, 8 onwards, the grades, and the mothers, the parents can be invited. The teachers can sit, we can train the teachers as well. They can even start in the nursing school as well. The nurses should be trained, as already mentioned, that the nurse plays a vital role. It can start in like in hospitals as well. Small sessions, fixed days, and maybe twice in a month, thrice in a month. This would be a like difficult step, maybe initiatively, but I think in years on, once we get into the practice, and we can see the responses, these are some of the venues I can suggest that would be paid.
That sounds fantastic. And, you know, one thing that we've experienced that's been very helpful is that before we actually go and train the teachers and educate them, is to start by listening to them and hearing what they think, and, you know, making sure that we educate and give our messages around what their own perspectives start with. And then that can end up being very, very helpful, because it makes sure that we're respectful, that people have, you know, their own perceptions and their own values. And when we respond to those, people tend to own the information that you're providing to them much better and can deliver it a lot better because we understand kind of where their concerns really lie. And I think the infertility, we've had that concern in many other places. And I think we can learn from our colleagues across the world of how, other people. So I'd also encourage us, always to reach out to our collaborators in other countries with similar cultures to see how they've gotten around some of these issues, because some people have done an excellent job. And again, I'll refer back to Malaysia on the vaccination program. They really did a lot of very hard work to prepare the communities before they introduced their programs.
Thank you very much. Thank you so much.
And maybe we can talk a little bit more about the nursing community, because I do agree that while most of what we deal with in cervical cancer at the moment is treating people who are already suffering from the disease, and that is in the purview of the hospitals and in the purview of the gynecologists and oncologists. But the prevention programs are going to be in the primary health facilities. So what could we do to, I've heard many times to empower the nurses and the midwives to do more to help with these prevention programs. So are there ideas about how we could actually do that?
Professor Pachi, we have Dr. Hera, and she want to add some more points during this discussion.
Oh, perfect. Thank you.
Hi, ma'am. I want to add that I belong to a government setup, and we have got programs of training our lady health workers, like we are doing it in family planning program. We teach them in our basic language. We teach them each and every method. They go at the doorsteps of the people. They move in the community. They are taught, and they all the myths and everything regarding family planning that we usually do, that is cleared, and they go door to door, and they then give the information to the females. They counsel their mother-in-laws to for their family planning methods, and they discuss with the couple as well. They counsel their husbands. So in that way, we are able to achieve some progress in approving the methods that they use for family planning. So we can do this, I belong to a government setup, and we do have got our lady health workers, we have community health workers, we have social mobilizers. So we can teach them regarding the disease, regarding the symptoms that a female may, because they are the ones who come in contact with them. Any lady at home, most of the females, they are at home, they are housewives. So they go tell them regarding this, that they are having some issues, they are having problem. So we need to educate them. And yes, that program can be initiated through our government, our initiatives, NGOs and our government, if they plan something regarding enforcement of some courses, like they have done for family planning methods, the polio eradication program, the COVID vaccine program, because all the lady health workers are taught about that. They have been properly explained what could be the symptoms, what are the side effects of giving a vaccine. And yes, it is completely safe and there is no problem. So public awareness is created door to door by with the help of lady health workers, the social mobilizers, the community health workers. So yes, a program should be initiated regarding cervical cancer vaccination and prevention. And I think it will help us more if we involve them as well. We should teach our nurses as well. First, if their mind is clear, first we doctors need to clear that ourselves, that yes, we should educate our doctor faculty that yes, this vaccine is safe, it's not harmful, and it will have a good result in future as well. Then we should come to our nursing staff, the nursing attendants, the nurses in the hospital, and on the lower, like other basic health work units and all. And then we should move to our lady health workers and social mobilizers and all. And in this way, I think we can educate our community. And after that, role comes with the media, social media and TV, radio. then people will know that yes. And ma'am, I think husbands play a lot more important role. The fathers play the important role in taking the decision. Females in Pakistan, they do depend on their men for decisions regarding fertility, regarding each and everything. They have to take permission, and if they allow, they'll follow that. So for that, I think males should be educated as well. That yes, this is important for female health, and this will help in our prevention. So I think that's important. So in
Yeah.
that way, it will be helpful.
No, I think I think this is fantastic. And I think you're, I love the fact that you're thinking about integrating this new program with what's already ongoing. And so, and one question I would just have that would be curious to me is that the family planning, which is a perfect way to outreach to the women, because as you say, they're at home, and we can bundle all of these things together. My question to you is, I suspect the husbands wouldn't be at home during the times where the outreach workers are actually going to the community and educating women. So can you think about where can we in Pakistan, what's the venue or the place that we can educate the men? Is it with the women together? Should we be thinking about doing it through the religious communities, or where could we target education for the men?
Start from home as well, because I think that we can start from home first if they are available, or we can have a meeting with them, because we have a lot of lady health workers. We have a very strong program of lady health workers in Pakistan. So and people do listen to them, because they are the ones who interact with the patient, to the clients first. Then they go to the other community or the hospitals or the basic health units. So yes, first is that if they can arrange a meeting with them, so they can, whenever the time is feasible, they are at home. Secondly, ma'am, usually the religious places like mosque, and in their offices as well, where they are working, in the governments, if they are working in a government setup, so we can have sessions there as well for men, like we are having for females. And in that way, in the masjids as well, we can have announcements that yes, this vaccine is safe. Like we have done it for COVID. We have worked really hard for COVID, and we were having we had done a lot of effort for polio vaccine, and then we have done effort for family planning. Then came the COVID vaccine, and now inshallah we will be dealing with this as well. So I think we can have it on starting from home, then to the religious places, then to the, even at, I think I told that maybe shopping centers and their offices and all, we can have it. And social media plays a lot of role. All the men are using cell phones. So public awareness can be created by that as well. We should make videos. We should tell those females who have been vaccinated that yes, they are not having any problem with this vaccine. And I think that will play a positive role in convincing the people that yes, this is something safe. So that is, I think, important. We should bring up those females forward who have been vaccinated. They are not having any issues with this, and they have been safe. And we can even, since we don't have much used vaccine here, it's not available yet, or maybe available at few places, but we can have researchers from other countries throughout the world. Programs have been run, so we can give them that surety that yes, these females who are vaccinated, they have been doing such, they are having kids, they are married, everything is fine. Because at Pakistan, the basic level is marriage, kids. These are the issues that we.
These are the values, right? The family is really the value. Yes, I and I'm sorry to interrupt, but I get excited sometimes when we think about these possibilities, because what I'm thinking, and what's always hard for me as a scientist, is I know the data that there is, I can look at the graphs and see that there is no difference in any kind of reproductive outcome between people who have been vaccinated and those who haven't. So I can say, yes, I understand that as a scientist. I also know when I try to, if I were to try to convince my mother right? She's not going to understand the graphs. So
must
so
say,
stories.
family is something that's very difficult. Regarding COVID vaccine, I know that, as Dr. Kalavanti said, that yes, it's very difficult to convince the family first that yes, it's safe, get vaccinated your daughters. So we need to convince each and everybody once we are clear about it. We doctors need to clear our point of view so that we are in a position to convince others. So I think first we need to work on ourselves and then we can move on to the community. Thank you,
And
ma'am. Nice.
yeah, and I think as we work on that for ourselves, you know, it's paying a lot of attention to how do we communicate the knowledge, because, you know, we can communicate to each other, you know, as, you know, I can communicate to a fellow epidemiologist, but that may need to be different than how I communicate to a primary care physician, or again, to my mother, who really has, you know, she doesn't want to see the graphs or anything like that. Where we are seeing some really good value is exactly what you're saying, is even with this, you know, with your cell phone, right? Just recording some women who have been vaccinated and have, you know, a healthy baby that they're showing you, you know, and those kinds of stories could really go far. And I think that's what I'm encouraging us to all think about is, you know, if you're thinking about showing a story like that to some husbands or to a medical doctor, who would they want to hear that from, right? Who would be the messenger that they would trust to hear the story and believe it, right?
Yeah.
Because I think that's the most important thing. And we can, you know, so yeah, I think that's what I'm encouraging is sometimes I think just giving my experience of where I struggle when I'm doing this work in the field is thinking, how do we communicate the information we know to all the different kind of people who have a different perspective and a way of looking at things, and making sure that we're seeing where they need to go, right? Here's the barrier they have. And so how can I communicate most effectively to them, right? So sometimes it would be through graphs and data, sometimes it might be through stories. And yeah, so hearing about your experiences in Pakistan of how you've met those challenges, I think that's really important. And then, you know, will be very interesting and I think applicable to how you can develop this new program.
Ma'am, answer to your question when earlier you asked that how we can involve men in Pakistan. It's very difficult in the middle class and low socioeconomic groups to involve their men. It takes time. So what I have the suggestion here for our audience here, that every year we have different kind of religious meetings going on. Every week we have a Friday prayer, and every year for 40 days, for example, yeah, caste, they have majalis for 40 days every day. And when the Rabiul Awwal comes, there will be milads and other dars and things. So all around the year, there are so many religious activity, especially for the 12 months Friday prayers is everywhere weekly. So what I suggest that we should involve our religious scholars to add in their sermon on regular basis some kind of health teaching, 2 sentences, 3 sentences. And when we start a campaign, for example, we start campaign for the cervical cancer for women. So we can just 2 sentences add, and we have to add scholars, religious scholars in this regard. Otherwise, we cannot attract men to talk about this and discuss about this. Thank you, ma'am.
I think that's a fantastic idea. And I think that engaging, you know, first with the religious scholars and sitting and again, talking to them, hearing their concerns. I know this is something that you're all doing on your own. I just am giving you the experience that we've had to clarify that what you're doing is the right thing, making sure that you are having those conversations together. And hearing what the religious scholars suggest would be the right way to communicate that information to make sure that you have high participation.
I am Dr. Anif and working in a tertiary cancer care hospital. I think this is very good program for not for only for the students but also for professionals also. In my opinion, in our culture, vaccination is possible, but screening is almost impossible. You know that for screening, some sexual organs are involved,
Yeah.
and this considers in our culture as taboo. And even in if you talk our participants to get have a sample, almost 50% will deny.
Yeah.
This is the cause. And for I think information and for awareness in general, primary care setup is one of the important stage. You know, in cancer hospitals, in our setup, most of the patients are came at the stage of 3 or 4, fourth stage cancer. And at that stage, you know that cure is almost impossible.
Right.
And
Right.
even our doctors and radiotherapists, they don't bother to tell them about the positive agent HPV and you know about vaccination. So what is your suggestion in this scenario?
No, I know that this is a reality in many places, and you know, I wish I had all of the answers. I think again, you can go to some of the other places, and I keep coming back to Malaysia simply because I lived there for 2 years, and you know, they also have you know, a largely Muslim community, and so culturally they had the same issues and concerns. And so I think there's a lot that maybe you can learn from talking to colleagues there, because they've done a great job both getting women screened and vaccinated. I'm wondering if in your cancer patients, again, coming back to the stories, if you can convince 1 or 2 cancer patients of how their cancer could have been prevented by something as simple as a self-swab and an HPV test or a vaccination, do you think that they would be willing maybe to, again, just be recorded to, you know, convey their story of how, if I had known this, you know, maybe I wouldn't be in the position I am today? And I think sometimes it takes finding the right person with the right, you know, attitude, because I think a lot of times when you're, you know, when you're faced with terminal cancer, you're going to be fairly fatalistic and maybe not feeling hopeful to give that kind of message. But I think if 1 or 2 of the cancer survivors, even of people maybe who you are able to treat, could be very powerful messengers to help convince, you know, people that this is something that they could have prevented. So I that, you know, and the other thing that I'm going to say is, you know, every place that I have worked where we suggested that we could do self-sampling for HPV testing, every situation with just one quick second, is that people said, no, people, you know, will not participate. Our women won't be willing to do this. And so everyone made an assumption that it would be unacceptable. And then when we offered it, we found very few places, if any, that I can recollect, where women weren't fine with doing the self-sample. So I think one of the things is we can challenge our assumptions sometimes. And because again, with the concern about, you know, the self-sampling just offers this unique opportunity for women to take care of themselves for screening without having to go into very uncomfortable situations where they feel their privacy is compromised, and only those who are positive then need any kind of follow-up care.
Second thing is the cost of vaccination. You know, in COVID and for polio vaccine, they are free of cost, provided by government.
Right.
Okay, but we have to purchase vaccine of this HPV, and this is, I think, much costly.
Yeah.
I think 5 years back, I have arranged for my family, and it was costing almost 10,000 for two shots. And even our family members, our cousins and all of it, I have tried to convince them. The cost is one of the
Prohibitive.
factors.
Yeah, yeah, no, I understand. I think,
Our government have to provide details of, or at least for lower class, free of cost.
yeah, I agree. I think that's probably the only way that this will happen. And I think the first thing that I also think is to make sure that you can get a free vaccine to every young girl, because that's going to be the easiest and most effective way to start the prevention of cervical cancer. I think we're all hopeful that because now we have, I think, an additional 3 manufacturers from China and India making a vaccine. And then I hope that you're aware of the more recent data saying that you're getting just as good protection with 1 dose of the vaccine. So there's no longer a need to do 2 or 3 doses, which becomes much more feasible both to deliver and much cheaper. So I think with more manufacturers with vaccines on the market, I'm hoping that the governments will find this to be a much more feasible program so that they can procure a vaccine and provide it free of charge to the most of the population. And unfortunately, I think we're getting close to the end of our time together, and I believe that I might need to go to a different Zoom room for the next session. But I found this discussion to be really, really interesting, and was hoping that what we would do is just to bring ourselves kind of an opportunity to brainstorm together to talk about these realities, right? Because the thing that I will say is I don't have the answers, obviously. People on the ground have the answers and can be innovative and creative about how we can approach some of these challenges. The one thing that I will leave you with is that I've taught myself is to make no assumptions. Before I decide what to do is really go out into all the communities. That's why I wanted to make awareness of all the different stakeholders that might play a role in making sure that we have available through the government, through the schools, and the women will accept to be vaccinated, to have their daughters vaccinated, to be screened, is really listen and understand where they're coming from in terms of their concerns, so that we can address exactly what's on their minds and hopefully do our best to allay their fears and make sure that we are speaking to what their needs are rather than what we in our own minds might assume that their concerns are.
Thank you, Anas.
Okay, well, I think with that, yes.
Thank you very much, Professor Petty. So, what will be the next? Have you made any conclusion?
Well, I think I just did. I think the conclusion is that you guys have a lot of different stakeholders that need to be, that can both be barriers and facilitators to your programs. And I think, continuing to think together about how you can, if you find that one of the stakeholders may be a barrier to getting, for example, a vaccine program off the ground, to make sure that you sit and have conversations with them, really understand where their concerns are, meet them where they need to be so that they can be accepting of, and understand what kind of information they need, what kind of ways that it's best to present information to different people, because I think that's the most thing that I've struggled with, is making sure that I can communicate the right kind of information to the right people. And I know that's often very, very different depending on who I'm speaking to. And just making sure that you think about all of these people that I think we know in our minds are going to be influencing kind of the acceptance of these preventive programs, but we maybe don't always go out and meet and speak with them in real time as we're preparing. So I'm just going to end by saying that this is a template, maybe to start thinking about this, that we've worked on. and to continue to work through that to make sure that you do get broad acceptance of the program as hopefully you will start delivering it soon, which we're all very excited for.
Okay. Thank you very much. And we all are very thankful for the very informative discussion over here. And I'm also thankful to our doctors, gynecologists, nurses, and other participants. So Professor Petty, we will meet with you after some time for your talk at 11.
Okay,
Thank you.
thanks
Thank you.
so much. Okay, see you soon. Bye-bye.
See you.